Hello and welcome to the award-winning Waterman Wellness, your pathway to health and wellness with local experts as your guides. I'm Melissa Huritzik. We have a lot in store for you in this episode, including not getting enough Z's. Our local experts have important information about causes of insomnia. Plus, this Groveland man explains how treatment for his potentially dangerous sleep condition changed his life. And Chef Tom has a delicious recipe to make on the grill that you'll be dreaming about. We begin this episode with information about treatment for a chronic disease that affects 43 million Americans. Aside from the discomfort it causes, arthritis and other rheumatic conditions are the leading cause of disability. The impact on her quality of life is what prompted Sarah Eustis to get help from Mount Dora orthopedist Samir Guru.
I used to walk in the morning 2 miles for years, and my knees started bothering me when I walked, especially this one, my left one. And so I just came to find out what I could do to improve it, and the arthritis was very bad.
Basically what arthritis is when the cartilage in the knee wears out and your two bones are then rubbing together, causing severe pain.
Dr. Guru decided Eustis would be a good candidate for knee replacement surgery.
Knee replacement is a procedure where we resurface the knee on the top and the bottom of the joint. Essentially, there's a metal component that gets placed on the femur bone, and then on the tibia there's a metal component, and those get glued onto the bone. And then there's a plastic interface that goes in between the two.
The whole procedure went just as I thought it would. I have great confidence in him. He's almost like a friend, not a doctor. He gives you a feeling of confidence. And he is warm, he is focused on you at all times.
Basically, after a knee replacement, you're in the hospital for 2 days or 3 days, and then you get discharged. When you go home, we have a home health nurse and a home therapist that comes to the house. Initially, the patient is not very mobile, and it's a lot easier for the patient to receive care at home. And then once they're mobile, they can come to an outpatient facility. Most patients will be doing pretty well by about 6 weeks. Some patients take a little longer to heal up, but by about 6 weeks after a knee replacement, most patients are very functional and able to do most things without pain.
Eustis is thrilled with the results after her procedure.
I feel wonderful, and my kids are all saying, "Oh, you're back to yourself, this is wonderful."
Visit the website fhwatermanortho.com to learn more about advanced treatment for arthritis pain available here in Lake County. Chronic pain, among other things, can impact a person's ability to get a good night's sleep. Local experts stress that sleep is very important to one's overall health.
It keeps something that is called homeostasis, which basically means a good functioning of your body. The ideal conditions for something to function. And your body is such an incredible machine that will be always fine-tuned to perceive minute changes, and will try to adapt to those. And sometimes it can, sometimes it cannot. Sleeping is a common problem. More common as you get older. Your need to sleep is less, for different reasons that have still not been completely figured out. Consider that not all treatments for sleep are medications, that you have to try many other things. Unfortunately, people have funny habits, and some of them interfere with the quality of the sleep, and even though they can create a problem even more.
Dr. Chang stresses that seeing a primary care doctor regularly is important to help keep track of health changes, including sleep issues.
If we are talking insomnia such as a sleep problem, it could be an indicator of some other neurological or psychiatric conditions that may be coming. Sometimes there are simple things as, I have pain. Pain does not let me get comfortable enough to sleep. Sometimes it's worries. Sometimes it's excessive urination. On the other hand, certainly very common nowadays as people get a little heavier, sleep apnea, which triggers so many other symptoms as well. Things like that, how you interpret signs or symptoms is essentially what we do, and not to have a preconceived notion of what the symptoms mean.
Aside from the frustration that comes with a lack of good night's rest, disrupted sleep can be dangerous in some cases. Specifically, medical experts want patients to be sure to address sleep apnea.
So apnea means cessation of breathing. So when we are awake and alert, our airway is open, so we can breathe in and out without any difficulty. When we sleep, our muscles go limp, except the muscles of the airway. These muscles need to stay alert and open to maintain our airway open. But sometimes, when with aging or weight gain, these muscles become more flappy, so they start to narrow.
Dr. Jalul says snoring is a symptom of sleep apnea.
Some people, the narrowing will continue until the whole airway closes shut. We go to sleep, start to snore, and then we suddenly stop snoring. The airway has closed shut. We're suffocating, basically. So the patient is trying to breathe, but his airway is closed shut. Oxygen gets slow, the heart slows down, they're basically suffocating, dying. This sends a message to the brain, hey, wake up, you're dying, and then suddenly the brain would wake up and will open up the airway. And with all the consequences of that suffocation, which could be from a few seconds to a minute, and that will, of course, put a lot of pressure on the heart and on our system, and that's why it is a serious medical problem. We need to open the airway. And there are different methods of opening the airway. The most used method is the positive airway pressure. So it's basically a pneumatic splint. It's like having a hollow tube that's collapsed and you put a blower and just open it up. So this is what it does.
Stephen Richardson of Groveland experienced sleep apnea, an overlap symptom of his chronic obstructive pulmonary disease. Dr. Jalul prescribed continuous positive airway pressure therapy, or a CPAP machine, to help.
It kind of throws you a curveball because when you first turn it on, you feel that pressure of the air, but everything balances, and I can generally be asleep within 5 minutes. You feel refreshed when you wake up. Otherwise, before I was wore out. When I woke up in the morning, that's like I hadn't even went to bed. That just is rough. It would take 2 or 3 days, and you'd be so exhausted that you actually did sleep through the night. But once we got the CPAP, it's party on. No,
You can find a specialist to help you or a loved one with any sleep issues by visiting the website on your screen. It's time to take a short break, but we'll have plenty more when Waterman Wellness continues. What does it mean to Lake County when a local employment center is recognized as a great place to work? Stay tuned to find out. Local organizations are partnering to help women with gestational diabetes have healthy pregnancies. We'll explain. And even meat lovers will love our Better For You burger recipe for the grill. You'll find additional health and wellness information in Waterman Wellness magazine. Visit watermanwellness.com to arrange for home delivery. And you'll also find a listing of the specialists featured in this month's episode. But first, you may be interested in attending one of these upcoming community events. Don't go away. We'll be right back.
It's time for the Creation Health Tip of the Month. Observing a weekly sabbatical is at the heart of quality rest. Today, find a place of worship that supports and encourages your spiritual growth.
Welcome back to the award-winning Waterman Wellness, your pathway to healthy living with help from local experts. I'm Melissa Huritzik. A local employer is receiving national recognition. For the 7th consecutive year, Adventist Health System, the parent company of Florida Hospital Waterman, has been named as a great place to work. Gallup recognizes organizations for their extraordinary ability to create engaged workplace cultures. The honor was announced just as Florida Hospital Waterman was welcoming back a familiar face as its new president and CEO. Abel Beery most recently served as Chief Operating Officer of Florida Hospital Orlando. He was COO of the Tavares campus before that and is happy to be back.
A lot of people today are looking for a workplace that allows them to meld their personal belief system or the things that have significance to them along with their career. We take what we do very seriously. We develop this not just for those whom we serve, but also ourselves. So I want Lake County folks to know this is their hospital, this is their place, and we're here for the long run. And a lot of that in terms of our investments, long-term investments, significant investment in this community shows that we're not just here to provide care. We are an economic engine. We are an employment engine. There is a text in Jeremiah 29:7 that says, "Seek the prosperity of the city, which you've been called, for if it prospers, you too will prosper." Florida Hospital Waterman has been in some form or another in this community for 79, almost 80 years. In that regard, who we are is intricately woven into the fabric of this community.
You can learn more about Florida Hospital Waterman's involvement in the community, as well as career information, by visiting fhwaterman.com. In other news, an effort is underway in Lake County to help pregnant women diagnosed with gestational diabetes. Like other types of diabetes, gestational diabetes affects how your cells use sugar.
Moms who have gestational diabetes who do not control their blood sugar, they often have babies that are too large to be delivered, which cause trouble for deliveries or increase in C-sections. The babies are so big they may have trouble in utero at the end of the pregnancy. And also those babies have a hard time maintaining a blood sugar after delivery. Florida Hospital Waterman is doing a collaboration with Lake County Health Department for a gestational diabetes clinic. It's something altogether new in Lake County, and we're very excited. Once a mom is diagnosed with gestational diabetes, which is usually around 24 to 26 weeks, their doctors will refer them to us. We will call and set them up with an appointment for their clinic appointment. We'll see them initially for a 2-hour class, which would include a dietitian, and then they will be seen weekly, where we have them check their blood sugars and make sure that they're eating the right things. One of the important things about gestational diabetes is that those moms have about a 65 to 80% risk of developing type 2 diabetes after delivery, perhaps in the next 20 years. So we will actually be following up with those moms and postpartum, making sure that they know what they can do for themselves to lower that risk factor for type 2 diabetes later in life.
Dudley says there is no charge for the gestational diabetes class, but a doctor's referral is required. You can find out more about services available to new moms in Lake County by visiting fhwatermanwomen.com. Perhaps you're looking for something easy and healthy to throw on the grill. Recently, I visited the Conry Creation Health Center kitchen, where the Florida Hospital Waterman team worked up a recipe even a meat lover will enjoy. If you enjoy using your grill during the summer months, then you might want to try this burger recipe with a twist. Today I'm here with Florida Hospital Waterman Executive Chef Tom Sewell and nutritionist Ellen Boyer. Ellen, would you like to tell us a little bit today about what we're cooking?
So we're making a blackened Portobello burger with a yogurt sauce. So Portobello mushrooms are high in different B vitamins, and those are going to be really good for maintaining red blood cells.
Sounds delicious. Tom, would you like to get us started?
Yes. For the marinade that we have for the mushroom today, we have some orange juice, balsamic vinegar, Dijon mustard, some blackened seasoning, an olive oil and canola blend, which is 90% canola oil and 10% olive oil. As you can see, this is some nice strong flavors. So they're really gonna bring out a lot of flavors in the Portobello. Okay, it's gonna almost like mask actually a burger. And that's the idea, that's what you want. All you wanna do is just mix it up, real simple.
And the orange juice in the sauce will also provide a little bit of vitamin C.
All you're gonna do is just take the Portobello mushroom. You know, one of my brothers is a vegetarian. We're always having, what we're gonna feed him. So this is actually a really great recipe. And you know anyone who's a vegetarian and they want to be like seen left out at the barbecue you're having. So this is something that you could definitely serve them. So now, as you can see, we have the Portobello marinated. Okay, so what you're gonna do now is just let it drain off a little bit, marinate a little bit, okay? You don't want it. If you don't let it drain off, what's gonna happen is the oil will burn the grill. It's gonna give you a burn flavor on your Portobello. You don't want that, okay? So you're just gonna on the grill, and that's a nice sound you actually wanna hear. Okay? So you're gonna let the portobello cook. I would probably say maybe 3 minutes on each side, somewhere in that area. Okay? So now we're gonna make yogurt sauce. Okay? First thing we have is some Greek yogurt.
In Greek yogurt, you want to use a plain Greek yogurt because it's high in probiotics, and that's really good for your good bacteria.
That makes a good point, because you definitely don't want your portobello to taste like vanilla, right?
Right.
So definitely. So what we have here is we have some cucumbers that actually shred and drained all the water out of it. The reason you do that for is that so your sauce won't be really watery. You really want to make it a nice thick sauce. Okay, let's have some sliced onions, fresh cilantro. I love cilantro, but you can use, if you don't like cilantro, you can use any herb you want. You can use parsley, you can use tarragon, be really nice in this. Basil, dill, whatever you like. We have some lemon juice and some salt and pepper. Okay. And then real easy, all you're doing is just mixing it. If you like it spicy, you can add some cayenne pepper, jalapenos, fresh jalapenos would be really nice in this. You can do all different kind of twists on this. You can make it more ethnic by using some cumin, chili powder. Really, it's endless on what you can add to this sauce. Okay. Just want to check your portobello. Flip it over.
You said about 3 minutes on each side?
Yeah, about that, yeah. And what we're going to do now, we're going to start build the burger here. So we have some lettuce and tomato. You can put anything you like on there. It would be nice on this. Would be sliced avocado would be nice to give another healthy thing on there.
And then we used a wheat bun instead of a white bun just to make it a little bit healthier.
Take the portobello on top. And we're going to just take the sauce. Now, if you want to be fancy, you can present it to your friends. You can put like a little top on top of it like that. Okay. What I would do is then you just put it on top. Like that. And then you can also leave the sauce on the side so they can actually dip something in there. It'd be really nice on the side, and maybe some carrot sticks or some celery sticks would be a nice healthy side. Instead of French fries, you can use the sauce for a dipping sauce for that.
Well, that was quick and easy.
Yeah, sure was.
So if you would like to try the blackened portobello mushroom burger, you can visit watermanwellness.com. We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. Be sure to watch the August episode right here on Lake Sumter TV for some of the following stories. You'll learn more about the exciting plans at Florida Hospital Waterman to enhance emergency services. A Lake County physician explains why some new moms struggle emotionally after giving birth. His helpful insight can help you or someone you love. And we'll head back to the Con Recreation Health Center kitchen, where Chef Tom combines fruits and vegetables into a bowl of deliciousness. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Melissa Hritzik for the award-winning Waterman Wellness.